Lobotomy Project, Cynthia Tanner. Imagine living your life with voices in your head, constant noise, to the point where you cannot discern reality from fantasy. These distracting sights and sounds in your head, the thoughts get confused and it's impossible to carry on a conversation, take care of daily tasks, or even take care of yourself. This is the reality for schizophrenics. It's a serious mental illness. In the 1940s and 50s, psychosurgery or lobotomy was the mainstream medical practice to relieve symptoms of schizophrenia. How can anyone think that purposeful cutting of the brain was beneficial? And how did it become an accepted and sought after surgery? People had been searching for long-term treatments for mental illness, but what they found didn't help, was fruitless. At the same time, there were many facets of the popular media that were promoting an awareness of mental illness. And also, there was a neurologist, Dr. Walter Freeman, who was becoming very popular as the champion for the cause of lobotomies in the United States. He convinced medical professionals and mental hospitals and families that he had the answer to their question of how to help their loved ones. So I have to wonder, given how little doctors understood about the brain, America was ready to willingly accept an extreme form of psychosurgery for mental illness. There were ineffective treatments at that time, and it was very frustrating for patients and families of mental illness. No treatments were effective in the permanent rehabilitation of the mentally ill. The best that could be done for some of these patients was to render them unconscious so they wouldn't harm themselves or anyone else. By doing this, they would administer insulin, high doses of insulin for insulin shock therapy, electroshock therapy, metrazole was another injectable, and also high pressure hydrotherapy were methods that they would use. And the thought was that these methods would shock the mind and the body into a type of reset mode that was thought to relieve the thoughts and the behaviors that was causing problems in the daily lives of the schizophrenics and the mentally ill. Usually families were unsure if they were making the right decision when they did finally come to the conclusion that they had no choice but to put their loved one into a insane asylum or a psychiatric hospital for professional treatment. They really believed that they were doing good, the best that they could. In the 1940s and 50s, the asylums were accepting patients even though they didn't have room. There was so much overcrowding, and it was difficult for a small staff to control the behavior of the patients. Financial situations at the asylums also proved to be a disadvantage because the money that was needed for food and for clothing and beds and therapy and even building maintenance just wasn't there because their small budget had to go across many people, many patients. The short staffing at the hospitals also kind of provided patients with less than the full therapy that they should have been receiving, even though it wasn't really that effective. But all of these combined left very little hope for the patients returning home to their families. Desperation caused families to consider any treatment that was available because years of unsuccessful therapies left their family members no better than they were when they started these therapies. But lobotomy promised to change that. Lobotomy is a surgical procedure that severs the connection between the frontal lobe of the brain with the rest of the brain. And the theory is that that would relieve their impulsive and sometimes destructive behavior. As a young child with a mentally ill mother, David knew, and this is his quote, "My mother had gone through all of the known treatments, all of the known medications at the time, and there really wasn't any other alternative." And that's the end of the quote. David's father read about this lobotomy surgery and wanted so desperately to find a cure for the mental illness in his wife that he agreed for her to have the procedure done. After her lobotomy, she was actually reintegrated with her family. And what David remembers is this. This is a quote. "She was being loving and almost happy. I just realized that the lobotomies were a godsend to me. They gave my mother back to me." And that's the end of his quote. And similarly, there's another woman, Angeline Forrester. She's the daughter of a lobotomy patient. And what she said was, quote, "She changed so radically for the better once the doctor had seen her. She never mentioned suicide again." In the mid-1950s, options available to the mentally ill changed. There was antipsychotic drug called chlorpromazine, and it was introduced into the United States. It was developed in France. This medication interrupted the chemical exchanges between the neurons in the brain, and in doing so, it took the edge off of the disturbing symptoms that are associated with mental illness. And as the drug became widely available, doctors were prescribing it more often. More patients were released after shorter periods of hospitalizations, and fewer patients had to be rehospitalized. Normal treatments, the other therapies, brought temporary results at the best. Families searched for treatment options anywhere they could, and with the popularity of newspapers and magazines, they were finding that the media was actually a very powerful tool in bringing medical information to them. Propaganda made Americans more aware of post-traumatic stress disorder in returning soldiers, to the point where they were unable to reintegrate with their families. Now, a government documentary in 1946 titled "Let There Be Light" highlighted the plight of some of these World War II soldiers that were highly traumatized by the war. The movie shows men being admitted and interviewed at a military psychiatric hospital. The film states that 20% of the battle injuries were of neuropsychiatric nature, and one person is named Roman Tritz. He was one of the 20%. He was a World War II bomber pilot. He experienced a very traumatic event as the only survivor in his squadron, and he witnessed the other planes in his squadron being shot down, and his comrades were falling out of their planes to their death, falling in thin air. And from that moment that he saw that, he experienced delusions and paranoia concerning government conspiracies. And to ease his symptoms, right before his 30th birthday, the Veterans Administration lobotomized Roman Tritz. In addition to the propaganda movies, there were popular movies in the cinemas that brought mental illness awareness to the public. 1931 started a series of Frankenstein movies. Dr. Frankenstein's assistant is shown in a scene to steal an abnormal brain to be used in Frankenstein's grand experiment. And after he successfully brought a dead creature back to life, the monster's behavior is very strange. And individuals and the town people started to attack him and try to run him out of town. And the reason for his strange behavior was the abnormal brain. And much like people with mental illness today, it's the abnormal brain in Frankenstein's creature caused the behavior, the inconsistent behavior, much like the mental illness today affects people. Mental illness is not anyone's choice, and they're often treated as outcasts and people to stay away from. 1948, another popular movie about mental illness was the Oscar-winning movie The Snake Pit, and that influenced public opinion concerning mental illness. In the movie, the character Virginia Cunningham became an inpatient receiving treatment for schizophrenia at a state-run mental hospital. Throughout the film, we see her day-to-day life while she is in confinement, and we also hear these confusing voices in her head. She received electrocurrent therapy, psychotherapy, sedation by injection, and restraint by straitjacket. We also see overcrowded living conditions with other women in her ward. The ward is understaffed. The staff that is there is overworked, and it's just a very drab environment. Medical personnel are shown being very physical with the patients. But Olivia de Havilland is the actress who played Virginia Cunningham. In her very believable performance, she allowed average people to observe life at its worst dealing with schizophrenia. Her performance brought empathy and awareness to the disease, but the ending of the movie is not realistic because after only a few months in the mental institution, she was cured. But did the public believe that staying in the hospital just for a few months was a quick fix? Were they excited to think, oh, those therapies work and everybody will live happily ever after? And now that we're hearing about lobotomy, maybe it's not such an extreme measure or unrealistic to think that this will help my loved one. If the other therapies worked, then why not try lobotomy as well? The public responded to the messages in the media about lobotomy through the messages in newspaper and magazines by seeking out doctors to perform the procedure. The method was brought to the United States in 1936, and right after that, there was a Time article titled "Lobotomy: Cutting the Ability to Worry Out of the Brain." The first American lobotomy patient was Alice Hood Hammett, and she exhibited a great deal of anxiety, so much so her husband had difficulty dealing with her. But after her surgery, Mrs. Hammett remarked, this is a quote, "I can go to the theater now and not think about whether my shoes pinch or what the back of my hair looks like, but I can really concentrate on the show and enjoy it." The media was eager to promote the message of lobotomy and mental illness, and Dr. Walter Freeman used the media and to get the word out about the effectiveness of the procedure he brought to the country. Prior to speaking at a medical conference, he would contact the newspaper in the location he was at. He would sell them his article that he was presenting, and they would publish it. And the headlines would read of these exciting advancements in the treatment of mental illness, and that caught the attention of much of the public. Small town newspapers to national distribution of films, the media did play an important role in publicizing mental illness and lobotomies, and it also gave Freeman a place to let his work be known. He enjoyed success for bringing lobotomy to America. 20th century Americans' medical community was held in very high regard. In the 1920s, researchers found advancements including vaccinations against tuberculosis, tetanus, whooping cough, yellow fever, diphtheria. Penicillin was the wonder drug fighting many illnesses. And as quickly as these drugs were developed, they became available to the public, improving the treatment for many common illnesses. Doctors conquered life-threatening diseases, and the public viewed them with great confidence. And that confidence translates into trust as more people visited their doctor. New treatment for mental illness was ready to be introduced. 1936, lobotomy was a psychosurgical technique promising relief from all sorts of psychological problems ranging from hallucinations, paranoia, dementia, and schizophrenia. It was introduced in 1935 at a psychiatric neurology conference in London. A lecture on lobotomy interested Freeman, who is a neurologist in Washington, D.C. The Portuguese doctor presenting it told of favorable outcomes of 6 schizophrenic patients whose aggressive and self-destructive behavior was reversed by a lobotomy. Freeman brought this procedure to St. Elizabeth Psychiatric Hospital in D.C., and 1 year later, he was considered an expert. The public was very interested, and the medical community, though, did not like Freeman's overt self-promotion because they felt it was coming before patient care. His method really was not highly accepted. He was criticized by stopping in the middle of surgery to take pictures. But his unorthodox quirks made patients feel safe. They felt like he would really take care of them. Howard Dully, the young person in this picture, was 12 years old in 1960, and he was one of the last of Walter Freeman's patients. His first impression was very favorable. He says, "I liked Freeman. He put me at ease. He had a soft voice and warm eyes." But a professional appearance and easy manner are not all that is needed for a reputation as a good doctor. Pauline Wayne, who was an aide at Lakin State Hospital Psychiatric Ward in 1953, was there with Dr. Freeman during his surgery. This is Pauline's quote. "Freeman was brutal. He had no feelings. He'd finish one and shout next. He'd finish another and shout next. And if one died, he'd say, 'Let's keep going.' I kept wondering, how could he do this to another human being without knowing for sure it would help?" His unconventional method was met, though, with very little opposition. He would use a simple procedure. His lobotomy was a simple procedure. First, he would render the patient unconscious using electrocurrent therapy, and the doctor would only take 5 to 10 minutes to complete the procedure. Access to the brain was neatly accessed through the upper eye sockets, and after the patient woke up, they wouldn't remember a thing. Freeman had been known to do up to 20 lobotomies in a single day without a sterile environment, anesthesia, or a surgeon. Thankfully, chlorpromazine developed, which put lobotomy out of business. Walter Freeman continued to visit psychiatric hospitals, and he performed lobotomies for $25 per patient. And his selling point to the administrator of the hospital is that spending $25 for that patient would save them $3,500, which is what the cost of housing and feeding and caring for a patient for a year. With a favorable outcome, patients did return to their families, calmer and more stable, and the hospital did experience an easing of their overcrowding. And suddenly, treatment options became non-invasive. There was no reason to choose lobotomy. Freeman tried to revive his specialty, but lobotomy became quickly a chapter in medical history. Psychiatrists, mental hospitals were relieved to treat chemically instead of with traumatic therapies and surgery. Many patients were able to leave the hospital and rejoin their families. Early years of lobotomy, family members prepared to take extreme measures in the hope of relieving the suffering of their loved ones. Some found it, but some didn't. Media stimulated greater knowledge of mental illness through film and promoting Dr. Freeman's procedure in magazines and newspapers. The general public was introduced to lobotomy through the media. And at the same time, Freeman used his charm and talent for self-promotion to convince the public that lobotomy was the saving surgery option for their loved ones. Frustrated that there were so few options to treat mental illness, families felt that there really was no hope. Even though not every lobotomy procedure produced an ideal result, many people trapped by the effects of schizophrenia did find relief. The following is an excerpt from a poem written by a lobotomy patient in 1942 to the surgeon who saved his soul from eternal hell. An artist's hands, a musician's too, give us beauty of color and tune so true. But yours are far the most beautiful to me. They saved my mind and set my spirit free.